Today we have a very special guest all the way from Boston, Massachusetts. He's a true veteran in scoliosis treatment. He's been using scoliosis, the spine cord brace, for over 10 years
10
now?
years, yeah.
10 years. Treated lots of patients. We've got him in town today, and I wanted to do a little interview and ask some questions.
Sounds great.
So welcome. Thanks for coming. We appreciate it. So, one of our biggest things is we get phone calls from parents. They don't know if their child has scoliosis or not, and we're like, why are you even looking us up, right? But somebody mentions scoliosis, or a nurse will say maybe you have scoliosis. What can a parent do at home to check? So maybe even one of the biggest problems in the United States right now is that we don't check our children because we're not told to check our children,
Sure.
right? So what would you suggest? How can a parent go ahead and look at their child and follow them through their growth?
Absolutely. It's a huge problem right now. So number one, they can eyeball their back. They can look at them without a shirt on, see if there's anything, if the shoulders don't line up, if the scapula doesn't line up. But there's also a test called Adam's test. And most nurses and most schools do this right now, where you lift the back of the shirt up, the child bends forward with both hands touching, and the parent is basically just looking from behind over the back to see if there's anything asymmetrical. One side of the back looks a little higher, one shoulder's a little higher, the hips are just not even. If anything looks out of place, even a little bit, absolutely they need to get checked. Because a tangent to that is a minor imperfection in the back or a minor asymmetry can be actually a major scoliosis. And they would have no idea if they didn't have an x-ray or went to a specialist like you or myself.
And so that leads me to really the topic of early detection, right? So how important is early detection?
Huge. With scoliosis, we just don't know where that's going to go. It could be a severe progressive scoliosis that ends up with serious health consequences, or it could be a minor one and you don't know, and it's not worth the risk by not getting checked.
So, we've been treating scoliosis for, close to 30 years now. And we've been saying for 30 years, treat it early, right? So everybody says there's no cure for scoliosis. So what does that mean, there's no cure for scoliosis? There's no cure because in the United States, the protocol is if it's not 30 degrees, then we don't do anything. So a curve could be 20, 25 degrees. The child could be pre-menses, have a lot of growth, and we're still not doing anything. So of course there's no cure for it because we're not treating it quick enough.
Right.
But I will tell you, and I'm sure you've seen this in your clinic, when you catch a curve at 15 degrees, man, it might not be a cure to where it gets to zero, but the outcomes are phenomenal. And so this early treatment for us is incredibly important.
Huge.
Right?
One of the worst things we can do, as a parent, is to wait and see with a scoliosis.
Right.
Wait and see. Other things you can wait and see. With scoliosis, it's not worth the risk. There's a lot that can be done, especially with the spine cord. The research is there. It is a very effective treatment to either stabilize, stop, and a lot of times that curve can get better.
So let me tell you, I want to tell our viewers how important it is to catch it early. If you wait, it could get out of hand right underneath your nose. So many patients come in and say, last summer we were at the beach, we didn't see anything. This summer, we couldn't believe what we just saw us in the bathing suit. We're like, oh my God. And we're making phone calls. And it had, gone from something undetectable to something that is recommended surgery. So this early treatment, this Adam's test that you talk about, and just doing testing at home and making the public aware. We need scoliosis awareness because we're not doing it in all schools anymore.
That's right.
Right? And so I always say the earlier you treat anything, right? It doesn't matter what it is. I spoke with Dr. Catarula last time, and she gave an example, with weight loss. Do you want to start, a good nutritional diet at 300 pounds or do you want to
Right.
start it when you're 10 or 15 pounds overweight? When do you want to take care of that? It's the same thing with anything. Bad teeth,
100%.
right?
100%.
Scoliosis. So we urge patients and parents to seek early treatment. And then adults. Adults know they have scoliosis.
Right.
Right?
Right.
So we had this discussion the other day with adults. Early treatment, of course, is not as important for them. They're not at this
Right.
high risk of progression.
Right.
Every growth spurt, they're not going to continue to progress, but they can with changes in hormones. And
Sure.
you talked about osteoporosis.
Menopause, we were talking about, right?
So,
Yeah.
what are your thoughts on menopause or osteoporosis in the spine?
Very important to get checked at that time too. We've seen progressive curves when they enter that phase where the hormones are, changing so drastically. The bones can morph; they soften with osteoporosis, and that can lead to a debilitating progression of that curve in a severe way. And case in point, last week I had that 11-year-old female that I was talking to you about. She went from 0. She was a case of a wait and see. Her doctor said, wait and see. It's, right now she's having some asymmetry. 8 months, 20 degree progression in 8 months.
Right.
So, but certainly as females and males for that matter, as they get older, it often is accompanied by a lot of pain, and we can see the arthritic changes that can be stabilized.
Well, you visited the office this morning in the clinic, and we actually had a new patient this morning that wanted us to check her, and we checked her, and we found claw spurs on
Yep.
her spine, right? So she's just starting to have pain.
Right.
She had this same curve that her daughter had.
Right.
She had degenerative changes, arthritic changes, and she's 50 years old.
That's right.
So do you treat it now when it's very treatable, or do you wait until the spine collapses?
Right. Early detection is key. Absolutely. It's just one of those things you just don't want to wait and see what happens.
Right.
At any age, I think.
Right.
So.
And totally agree with that.
Yeah.
And we've just got to get that. I haven't figured out scoliosis awareness yet and how we can get this out
Right.
to every school. I don't know if you know this, but years ago, there was a U.S. task force that came out and said, we're going to pull scoliosis screenings from the schools. And they pulled them from the schools because they were saying that there wasn't really a treatment anyway. There's no treatment for scoliosis, so why check for it? And if they get to surgery, then they need to have surgery.
Wow.
And they pulled it. Surgeries went up because kids weren't getting treated soon enough. They're starting to pull back and get back into schools, but many schools still, they don't do them. And so I always ask a patient when they come in, I'll have a conversation with a parent, and I'll say to the parent, how did you find this? Right? And 1 out of 100 is school. 1 out of 30, my pediatrician. Right? So it's maybe the parent just saw something that's off.
Yeah.
So what I say is, it doesn't matter if it runs in the family. It doesn't matter if you've never seen anything before. These kids, it doesn't matter what age, do the test you spoke about, have them bent forward, look for asymmetries. If you see something, make a phone call.
The check is harmless, and it's an easy thing to do. Bring them in somewhere and have your child looked at.
And it can save their future, right?
Absolutely.
Completely save their future. So anyway, if you have more questions, please go to our website, scoliosisfix.com. You can give us a call. Our system will take some information from you, and one of our doctors, we have plenty of doctors, one of our doctors will give you a call, answer all your questions for you. It's absolutely free to do that. There's no charge for these consults. You can talk to a doctor at no charge. And so give us a call. If you have any questions about your child, don't wait. We're here to help.